If you do unnecessary medivacs, or if you're known to do unnecessary medivacs repeatedly, you will probably get dismissed from your employment. Some captains usually will say that, oh, who's the doctor who's coming next? Oh, it's Dr. XYZ. Then the captain will say, fuck, I know this doctor, we usually do 3 medivacs a week with this doctor. Hi, Tam here. I got an interesting question. Somebody asked me, what are the medical protocols to doing a medical evacuation at sea? It's an interesting question. Once you've decided to do a medical evacuation, that this is a life-threatening emergency, and this passenger or this crew member needs to be evacuated immediately. The people who are going to help you are the Coast Guards. When cruising around or close to the US Coast Guards. Close to Australia, it will be the Australian Coast Guards. Close to New Caledonia, it will be the French Coast Guards. If your ship is close by Italy, the Italian Coast Guards. So the Coast Guards are the people that you will contact. So let's have a concrete example, right? You have a patient, he suffered an acute cardiac event, massive STEMIs, and you've thrombolized already. And now you want to evacuate him to go to a cardiac ICU urgently. So your first step is, you will call the captain, your captain, and explain the issue at hand. And tell him, Captain, look, this is an emergency, this patient has had a massive heart attack. We need to disembark him urgently. You will meet the captain at the bridge. So you go to the bridge, meet the captain there, and you'll explain the issue. And then the captain will look at our current location, where the ship is, and based on where we are, make a decision. So the captain might say, oh, look, we are not too far from the coast of Noumea, New Caledonia, right? We're 300 kilometers away. Let's call the Coast Guards, the French Coast Guards. They could deploy a helicopter, take our patient off the ship to Noumea. Noumea in New Caledonia. Noumea is the capital of New Caledonia. It's got a good hospital, quite large hospital, very modern, and they've got all specialties available. I've been there myself. It's very good, ICU and all that stuff. ICUs, I should say. So the decision is then taken that yes, we're gonna take our patient to Noumea. Next step is to call the Coast Guard. So the captain will call the Coast Guard and then tell the Coast Guard, look, I've got the ship doctor on board with me. We have an emergency, medical emergency. I'm handing the phone to him, he's gonna speak to you. And then you are gonna explain your case to the Coast Guard. Yes, I've got a 40-year-old gentleman. He's had a massive heart attack. This is the situation. He's hemodynamically unstable. So blah 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 blah. You explain the whole situation of the patient, and the Coast Guards will say, you know what? We're contacting our flight surgeon. Hang on. And then they'll put the flight surgeon on the line, and then you will discuss the matter with the Coast Guard surgeon, and the Coast Guard doctor. And at this point, it's going to be a conference call, the Coast Guard, their doctor, you, the captain, and you're all going to discuss the case. And the decision will be made that yes, the best option in this case is to take the patient to Noumea, We've got a helicopter here. It's a French Puma or Super Puma with a range of, say, 650 kilometers. So we're going to deploy and we'll take the patient. You know, the good thing with the French Coast Guard is that they always come with a doctor. So the Coast Guards, the French Coast Guards are excellent. When they deploy, they come with a helicopter, so whether it's a Puma or a military Super Puma or any other type of helicopter, right? I'm talking about Pumas and Super Pumas because they've got high ranges. They can go far at sea, right? But if you're saying you're only 200 kilometers at sea, I mean, they might bring a smaller helicopter, you know, with a smaller range, depending on what's the situation, right? The Coast Guards will come with a doctor. They will arrive, circle around the ship. Usually they bring 2 helicopters, one that will do the operation of taking the patient up in the helicopter, while another helicopter is creating a perimeter around the ship and just circling around the ship. The Coast Guards are gonna go down, they will not actually land. I mean, it depends, but usually at sea, they will not actually land on the ship. You know, I mean, the ship, like I said, is in the middle of the ocean. There is movement, there might be wind, so usually we just hover above the ship, drop a line, the Coast Guards will come down, doctors will come down, and then they will take over my patient and I will hand over my patient to them, you know. And then the patient goes up in a stretcher or a basket or, you know, whatever is necessary. The doctor goes up, the Coast Guards, the rest of the Coast Guards go up, and off they go. It's not always a helivac, a helicopter evacuation. Sometimes it's done by boat. It could be a large boat, a large Coast Guard boat. It could be a smaller boat, you know. It depends on the condition of the patient. Again, you know, the situation of the patient. But sometimes it's the fastest thing to do. There could also be a plane. I remember being on a small island. It was a small private island in the Bahamas where the ship was docked for the day. Well, not docked, you know, we actually, yeah, we anchored at sea, and then it was tender operations for the passengers to go and enjoy the day at the beach. But we had a medical emergency. It was, in that case, what was that? I mean, it happened several times. We had an acute cardiac event, you know. Patient was having a coronary event, a heart attack. And the best solution at the time was to get a plane, right, a seaplane. So a seaplane came from, I think they came from Nassau, if I'm not mistaken, yeah, the capital of the Bahamas. So they came with a seaplane, landed, you know. How do you call it when a seaplane lands? Yeah, landed in the water. Doesn't sound right, you know, but anyway, you know what I mean. The seaplane landed in the water, so we had disembarked the patient from the ship on a tender boat, on a lifeboat, to the beach. So we're waiting at the beach, and as soon as they arrived, we took our patient into the seaplane and off they went. So these are the different options you have. Once you make the decision to do an evacuation at sea, taking into account the condition of the patient, how will the patient cope with the mode of transportation, you know, all that has to be taken into account and a decision has to be made. All right. So that's part number one. That was about the logistics, all right? And sometimes, by the way, still on the subject of logistics, sometimes the Coast Guards are going to refuse. Right? The French Coast Guards or at least when I was dealing with the French Coast Guards in Oceania, New Caledonia and, towards the old Australia, New Zealand, New Caledonia, the French Coast Guards are very active there in the South Pacific. With them, it was very easy because they are extremely good when it comes to evacuations at sea, Like I said, they always bring their own doctors. The US Coast Guards do not bring medics. It's Coast Guard personnel, but non-medical personnel. So if your patient is intubated on a ventilator, they will not come unless one of your staff on board, one of your medical staff, a doctor or a nurse, goes with them, which makes sense because they're non-medical. So if there's any problems there, the tube, the patient is accidentally extubated, because there's movement, it's a helicopter, or the patient crashes or arrests, something like that, at least there's a medical personnel who can intervene. The most important part of your job is to make sure that your patient doesn't die a completely avoidable death or unnecessary death. Meaning you should be able to identify medical conditions that could deteriorate and lead to the death of your patient. And so if you're able to identify those things, those conditions, and recognize that your patient is at risk and your patient will deteriorate and will die, or will have severe complications and sequelae of the disease that they have, then you have to call for medical evacuation to a higher level of care. So number one, you must use your years of clinical experience and knowledge in emergency medicine to identify those patients and be proactive and call for a medevac when your patients are at risk. But number two, you must not do unnecessary ship deviations, medevacs, calling the Coast Guards unnecessarily and all that stuff. Doing a ship deviation is very expensive. You have to be careful not to do unnecessary disembark. I'll give you an example. Your patient has a Bell's palsy. And the patient comes to see you, and let's say it's a woman, she's 45 years old, and she tells you that, hey, you know what, doc, I can't feel the right side of my face. And so you decide that, it must be a CVA. She's having a stroke. When did it start? She started feeling this way in the morning at breakfast, but she didn't think much about it. But now she's scared. She's thinking, she's saying, "You doctor, I'm thinking I'm having a stroke here. I can't feel the right side of my face." You do an examination. An examination is clear that it's a Bell's palsy, right? Both the upper and lower part of the face might have sensory deficits. There is no other neurological affectation. The rest of the body is 100% okay. Speech is normal. There is no Lyme disease in the area, meaning the area is not endemic for Lyme disease. Look, it's a textbook Bell's palsy. But you decide to do a medical evacuation. And so you divert the ship, you skip the port of Fiji, you arrive in Noumea, you disembark your patient. And maybe some few hours before arriving in Noumea, actually you call the Coast Guards, they come with a Super Puma helicopter, they take your patient in. They arrive in Noumea, and as soon as she's there, it takes the doctors there 5 minutes to diagnose the Bell's palsy. They're like, come on, this is Bell's palsy, there's no CVA here. They do a scan just to be sure, and the scan is completely normal. So now, You've used so much resources. You've deviated the ship. You've called the you've called the French Coast Guards. A port has been missed. It's costing the cruise line so much money now to do, to do this deviation, fuel and all that stuff for a Bell's palsy. That could have been dealt with on board. Conservative management, steroids and all that stuff. And then observation, and if there is clinical neurological deterioration, then yes, you can take it from there. So just be careful, because if you do unnecessary medivacs, or if you're known to do unnecessary medivacs repeatedly, you probably get dismissed from your employment. Some captains usually will say that, oh, who's the doctor who's coming next? Oh, it's Dr. XYZ. Then the captain will say, fuck, I know this doctor, we usually do 3 medivacs a week with this doctor, the helicopters are coming in 3 times a week, plenty of unnecessary medivac. I'm not a doctor, but from what I see that, sometimes they're telling me that the report I get from the office is that, it was nothing serious, You don't want to be known as a doctor who panics or doesn't have the clinical knowledge and skills to avoid unnecessary medivacs. Patient falls, 25-year-old, with a radial fracture, all right? So there's a radial fracture on X-ray, it's a non-displaced fracture. There is no comminution. There is no angulation. There is no displacement. It's a closed fracture. There is no scaphoid involvement. There is no ulnar styloid involvement. No scaphoid fracture, no styloid fractures. It's a simple radial fracture, non-displaced. And you want to do a medivac, you want to call a helicopter, no. Yes, you'll do that, and you might motivate for it. And your medical director will probably say, okay, if you really think that there is neurological complications here, and yes, let's do a medivac. But it turns out that there was never any neurological complications here. That's not good. You've got a patient with a DVT. You don't have a Doppler on board, but clinically it looks like a DVT. The patient doesn't have too many comorbidities. You could just put this patient on enoxaparin twice a day, according to weight, and then in the next port of call, send the patient for a Doppler study and further treatment if necessary. Right? But no, you're in a panic. You ask for a ship deviation, so the ship now has to deviate to another port, maybe miss the next port, or you call for a helicopter. All these things, you're going to get a reputation and you're going to get fired. At the same time, I've seen cases where, or I've heard of cases where patients were kept on board where they clearly needed to be disembarked. It was a medical emergency. But the doctor felt that it's nothing serious until it was too late. And they realize that, but this patient is going to die. And they call for a helicopter or they do a deviation, but the patient dies on board. That happens as well. So it's a balance, and that's why they hire you. And that's why the job description or the requirement is that you must have emergency medicine experience, preferably years of emergency experience, so that your clinical skills, your experience and knowledge will help you in such situations. It's not enough to have ACLS and ATLS and PALS and all that, You need the experience, the common sense and all that stuff. And you're only getting the experience through years of clinical practice on the floor of the ER. I hope this helps. Cheers. And remember, if you like this type of content, if you like this video, please leave me a like, leave a comment. I'm going to reply to you, and subscribe. I would really love it if you'd subscribe to my channel. If you like it, of course. Cheers. Thank you very much for taking the time to watch this video till the end. If you've liked this video, please leave me a like. If you have any comments, leave a comment. If you have any questions, leave a question. I'll answer you. Don't forget to subscribe. My goal is to now get to 600 subscribers by the end of the month. Around the United States, it doesn't give me anything additional or takes anything from my qualifications. I'm working on it. Now, this video is a hotel, right? Because this has been on mind for a long time, working in the Navy. But I understand the larger partners, this is for degrading the crew and stuff. You go on cruise ships every year.